Good morning. Thank you, Joelle, for that wonderful opening reception. So I'm just going to pull up my slide. Just grant me a minute to do that. In the meantime, I'd like to introduce my co-host, Wanda Maragni. And just want to, she's the chairwoman of our Interfaith Committee. And oh, here we go. Okay, sorry. All right. All right, so just briefly, you saw the video that explained what we do. Just briefly, we are the Substance Abuse Prevention Coalition here in Essex County, dedicated to reducing substance use and abuse and improving the overall health of all our residents here in Essex County. Our Interfaith Committee empowers the faith-based leaders of Essex County to understand and engage in issues affecting overall wellness in their communities. Our chairperson is Wanda Maragni. Our vice chair is Michael Doughtery, and our secretary is Desyra Barnes. Just some housekeeping information. Participants' audio and video will be turned off during the presentation, and it will be turned back on during our breakout sessions and our Q&A. Use the Q&A box on your screen to ask the presenters any questions, and then we can have them answer it at the end of their presentation. All our webinars will be recorded and available on our YouTube page at Essex Adapt. Please complete an evaluation upon the conclusion of each webinar. You will be given more information at the end. We will have a raffle at the end of the entire symposium. For each webinar that you attend, you will receive 2 entries for participating. We will take the information from the email that you registered with, as well as you will receive 5 entries for participating in our resource fair, which is going to be held on the last day on October 29th as our last session. The drawing for the raffle will take place on October 29th during our closing remarks, and we will be raffling off some gift certificates for our local restaurants that have been hard hit with that pandemic. Okay, I'd like this time to introduce our panelists, our presenters for today. Michael Doughtery, he is the co-occurring disorder specialist for Clara Maass Psychiatric Services and Psychiatric Emergency Screening Services at Clara Maass Medical Center. Along with Michael will be the director of Psychiatric Emergency Screening Services, Ms. Wanda Maragni, as well as Chaplain Cathy Palazzolo and Desyra Highsmith. All are working at Clara Maass Hospital, Clara Maass Medical Center. So without further ado, I'd like to give you the opportunity, Michael, to introduce the rest of the panelists. Oh, we can't hear you. You're on mute.
Is that better?
Yes.
Okay. Good morning, everyone. Thank you for being with us this morning. We at Clara Maass stand ready for Essex County and the community to assist with everybody who's involved with the very important work of dealing with those who are addicted to alcohol and substance abuse. Over the past few months, we have all been inundated with the pandemic. Some of our services had to be restricted because of the volume of virus cases that came, but we've always been here. We're still here. And those who will be presenting to you today will give you a little idea about how we can help and what we're doing. First presenter will be Wanda, who is the director of the Psychiatric Emergency Services. And Wanda, good morning.
Hi, good morning. Can everyone hear me?
Yes.
Great. Thank you for inviting me to join you today. Michael has asked me to kind of give you an overview of what we do at Clara in the screening center and how that may relate to our patients who present with substance abuse issues. The screening center at Clara began in 2017. So we've only been in operation for about 3 years, a little over 3 years. Actually, in November, it'll be 3 years. It's part of the state law, which requires that every county in New Jersey have a screening center that would provide mental health services to individuals presenting in the ED. Our screening center covers the western section of Essex County, which is the largest section of screening services in the county, which includes 20 municipalities. There are 2 other screening centers that also cover Essex County, one at UMD&J and one at Newark Beth Israel. They cover Newark and Irvington. So we have the entire rest of the county to cover. We have affiliation agreements with 2 other facilities at Hackensack Mountainside and East Orange Medical Center to cover any screening requests in their emergency room. We also do that at St. Barnabas Hospital. And our catchment area includes several other facilities where we respond to as well, which is the VA Hospital in East Orange, and the 4 college campuses at Montclair University, Caldwell, Bloomfield College, and Seton Hall. So we have a very wide area of catchment area. The screening services is there to evaluate individuals who present in the hospital or who are found in the community to be in some mental health crisis. And this process determines whether the individual needs any psychiatric hospitalization, and the goal is always to develop the least restrictive treatment plan. We have a mobile unit that goes out into the community to assess individuals there and determine whether or not they need to return to the hospital for further assessment. This unit performs about an average of 100 mobiles in the month, covering, again, that western part of the county. And our goal is to divert the individual from necessarily having to go to the emergency room. That's what we would prefer, to be able to address any issues in the community, to provide assistance or resources to hopefully keep them from having to come to the hospital. But if need be, they would be then transported to the hospital for further evaluation. The screening services here at Clara Maass, just to give you a little idea, it's pretty big. We have 53 staff, which consists of mental health screeners, which are fully certified by the state, nurses and mental health associates, and then we have support staff. Michael being one of those as a co-occurring specialist, but we also have a family support specialist and child clinician who operate on a daily basis here in the hospital with us. The unit that we have, which we just moved into in November, it's brand new. It has 6 patient beds. And any overflow of patients remain in the ED. We see them there, or they stay there until they can be transferred over to the PES unit. And we see all children in the ED. They do not come into the unit. So all the patients that come into the ED, the requirement by the state law is that the patient is first medically cleared in the ED, examined by a nurse and physician. Once they're medically cleared, determined to be medically cleared, then the certified screener conducts the interview. This is done for a number of reasons. And because we see quite a number of patients who have a substance abuse issue, we need to first determine that their current presentation is not due to the substance or to some other underlying medical condition before we just start to screen them. So there are very strict guidelines in the law about patients being medically cleared and what would constitute medical clearance for a patient who perhaps presents under the influence of alcohol. There are very specific guidelines as to when we would then be able to assess them. We do utilize telepsych services here, which has been a tremendous assistance to us, especially during this COVID period. We were able to, because of the pandemic, we were prevented from being able to go into the community and to other hospitals for a time being. So using the telepsych services that we have in place made it easier for us to be able to still see patients in these other facilities. So once a patient is seen and medically cleared and they come back to pass the screeners, start their assessment, collateral contacts are called, and certainly a big part of that is reaching out to any other providers that they are affiliated with. We develop a treatment plan, and it's determined based on the evaluation whether or not the patient can be discharged with referrals, whether they need hospitalization, and whether that can be either voluntarily or involuntarily. We start the commitment process here if patients are appropriate for that, and we then look for beds for them in the appropriate setting. Our involuntary beds are currently located at East Orange Medical Center. They used to have the program. They used to provide the screening services for the county, and so that, but they continue to have the involuntary beds there. So many of our patients are then transferred to East Orange. While they're here in the hospital, if they're here staying, they will receive any kind of medication that the doctors feel is necessary, or any prescribed medications that they have. They're continuously monitored while they're on the unit by the mental health associates and the registered nurses. We use IM medications and restraints only to rapidly gain control of patients who have extreme symptoms and who are extremely agitated, in order to keep them safe and to keep the staff safe. Obviously, none of these things are ever used punitively. And so, again, the law is very strict and has strict guidelines about the use of restraints or IM medications. Once the patients are seen by us, and as I started to say before, we do see a large number of patients who do have a substance abuse diagnosis. Probably be about 41% of our patients have a substance issue, and probably even a much greater number than that have a co-occurring. They are here, they have mental health diagnosis, but there is also the issue of some substance use. Here at Clara Maass and throughout the Barnabas system, we have a very, very active and strong peer recovery program. So all of our patients that we see in the ED, while they're being assessed, if it's determined that there is an underlying substance abuse issue or primary, we will refer them to the peer recovery specialist. They will meet with the individual, as will Michael, and kind of talk with them about what their best options may be. Since the use of the peer recovery program and here in Clara, it has made it much, much easier to help direct individuals to inpatient treatments, which was at times very difficult to get. So that has really made a tremendous difference in the resources that we can provide for our patients who need to be in detox perhaps, or in some recovery program. So we use them quite frequently. We have a 24-hour hotline. We're also required to do that. So anyone can call to the hotline to get either information for themselves or for someone else, to recommend someone that may need us to go out to do a mobile on. And we have, again, the screeners will speak with the caller to determine what the situation is and make a decision as to whether or not we need to respond. When we do go out, the staff go with the police to ensure the safety for the individual as well as the staff. They assess the individual at the location and then again determine whether or not they need to come back for further evaluation. That's basically a short presentation of what we do at crisis. The law in New Jersey has been in effect since the 70s. Every state in the country has some form of a screening law. It was designed to ensure that individuals in a mental health crisis would be treated fairly and that their rights would be held. And that, you know, back in the days, individuals could very easily be hospitalized for an extensive period of time based on very little information that they may have received regarding why the person was acting the way they were acting at that given time. So today, the law is there to protect them, their rights, to make sure that we assess them fairly and determine what level of care would be best for them. I have attached the last slide here, which has our hotline number, and we're open 24 hours a day, every day of the year, as there's staff here to call and to talk to. So you can always reach out to us, and again, we have screeners that would be able to provide you with resources and advise you on whether or not you should come to the hospital or whether the individual should come to the hospital. And we're always here to help and consult. Does anyone have any questions? Okay.
Okay, thank you so much, Wanda. I'm looking in the chat, in the Q&A. I don't see any questions just yet, but maybe towards the end they may have some more. Okay, thank you so much. Who will be going next? I can stop share. Okay.
Jessica, can you hear me?
Yes, now we can hear you, Michael.
Okay. All right. Thank you. And again, as Wanda said, Clara Maass, the emergency room, we will be able to assist anyone who has a drug or alcohol problem in finding the appropriate treatment that is necessary. We will utilize our friends at ADAPT and the various organizations for resources. And we're happy. We have the recovery team. Again, things have been recessed a little bit due to the virus, but we still stand ready to help you with that. In the coming days, I'm sure that this will persist for us. For the virus, they will come up with therapeutics. They will come up with a vaccine. But all of the damage that is done by the excessiveness of drug and alcohol use now will not be helped by any therapeutics for the virus. We all will still be involved in helping those people who have had this increase. And we stand ready. The number is there. Call and we will direct you and help you the best we can. And the presentation we're going to have.
Excuse me, Michael, I'm sorry. There is a couple of questions maybe that I'm not sure if you were able to answer them.
Okay.
It's what are the screening laws in here in New Jersey regarding, I'm just trying to grab it really quick. Yeah, if everyone could put their questions in the Q&A box, so it's a little easier for us to see the questions. So the question was, what was the law for screenings in New Jersey?
So can you hear me? I'm not sure.
Yes.
Okay,
yes.
Great. So the law in New Jersey, and as I said, in every other state, is basically designed to keep people's rights around commitments. So in the state of New Jersey, individual cannot be committed unless they are seen by a screener and then by a psychiatrist. There are then very specific time limits as to how long a patient, for example, can be held in the hospital before that determination is made. So therefore, someone couldn't just send someone to the hospital and we would have them sitting here indefinitely without a disposition made as to whether or not they were to be hospitalized, whether or not they needed to be committed. So the screening law basically is to set very specific guidelines as to how much time can go by before the commitment process starts, and then how many days. And in the state of New Jersey, we can then hold someone for 72 hours, at which time another psychiatric assessment has to be made and sent to the courts if it is felt that the individual needs to continue to receive treatment. So basically, and the guidelines also spell out all kinds of other rights that the individual either continues to have or doesn't have while they are under a commitment. But it is very much designed to safeguard an individual's rights if they need to be committed.
Thank you. Thank you, Wanda. I have another, I guess it's a request from one of the attendees. Can they be sent information on your detox or inpatient treatment? So maybe, I don't know if you have a brochure or pamphlet, we can send it out to all the attendees so they have your information.
So I'd be happy to share information about the screening center. Clara Maass does not at this time have a detox program. We have a voluntary unit and we have an involuntary unit. Very often, because many of our patients do have co-occurring illnesses and may need to have some kind of detox, they will be treated on the unit if they have been admitted for voluntary or involuntary treatment for their mental health issues. So if there's a co-occurring, we don't have a strict detox here. If someone just needs a detox and there is no psychiatric component, that's where our peer recovery people come into play, and they help us find detox to refer the individual to.
Okay, thank you.
But I'll be happy to, make sure that you get our brochures.
Okay, great. And we'll send that out to the attendees in some fashion. Okay. If there's anything else, you can put it in the Q&A box. Let me see, is there also, okay, another question. Is there a medical power of attorney? How is the process done?
So there certainly are medical power of attorneys. Anyone can have that done and designate whoever they want to do. You can do it many different ways. It's very easy to just download a form from the internet, or you can go to an attorney and have one drawn up, and it will designate someone to make decisions for you medically if you're incapable of making those decisions yourself. So the power of attorney doesn't really come into play. For example, if, let's say, I had someone that I felt needed to be hospitalized for treatment, if they were capable to make decisions, I, as the power of attorney, could not supersede that unless that person was in a situation where they were at that point deemed to not be able to make their own decisions. Does that make sense? I hope so.
I think so, yes. Thank you. Okay, just checking one last time in the Q&A box. I don't see any more questions. So thank you so much, Wanda, for that, for the wonderful presentation and the information on how we can obtain services for those in need. Next, I'll be introducing you to Desyra Highsmith. She will be providing, I'm going to stop share my screen so she can share her screen. Okay.
It's still saying host disabled.
Okay, let me, okay. All right. Try it now.
Okay, and everyone's, let me see. Okay, can everyone see my screen?
Yes.
Okay, wonderful. Well, good morning, everyone, and thank you for the invitation to join you this morning. My name is Desyra Highsmith Holcomb. I am the Director of Diversity and Inclusion at Clara Maass Medical Center, and today presenting with me is our Chaplain Cathy Palazzolo. And so we just wanted to share with you the opportunity to partner with us in the care and recovery of any members that you may wish to extend outreach to that are patients in our hospital, and kind of explain to you some of the programs we have underway and how that kind of works, not only regularly, but also in this COVID world and limitations on visitation and safety measures in place, to make sure all of our faith community partners are aware of how they can best connect with members that might be patients in our hospital. So we want to explain to you today how this partnership can work. And when we say partnership, I mean, we have always had a spiritual care department, but we really are looking to strengthen and build the relationships with our community partners. We have a priest who is on staff. He's a priest from the Archdiocese of Newark, who is at the hospital Saturday through Wednesday. Cathy Palazzolo, who is with us today, is a chaplain that serves and supports all faiths that are hospitalized and provide spiritual care and support to them. And she's also at the hospital several days a week. So it's really important to us that we provide this support and coverage because we understand that spiritual care is a huge part of recovery and recuperation. This level of support and connection can be critical to the recovery process, the connectedness that the patient feels to their community and their faith community. So we want to encourage you to be in touch with us and to work with us to ensure that any of your members or community members, whether they're members of your faith organization, your house of worship, or just community members that you happen to know are at Clara Maass Medical Center, we want to be connected with you so that we can be certain that we prioritize and make sure that that patient is getting care and visitation, and that if there's communication that needs to happen between that faith, that house of worship or that faith community and our chaplains and priests, we can make sure that we can close the gap with that communication. And Cathy's going to be talking with you a little bit more in depth about how that works. But I just wanted to share with you, and it's probably no news to any of us on this call, that spiritual support could be quite helpful in the recovery process for addiction. And I pulled this article from Psychology Today, written by Dr. Adi Jaffe. And he talks about some of the areas, the 7 key areas and spiritual elements that are critical for addiction recovery. So that being the priority, these are some things that we probably understand naturally are quite relevant in the recovery process. So finding one's purpose, making contribution, bringing mindfulness to recovery, all of these things that could support a person from that that need for that addictive behavior. Connecting with something greater than yourself, practicing gratitude and having accountability are all parts of most every faith. And the piece that we wanted to focus in on today was the establishment of yourself as part of a community. When you feel that you're supported and that people are really in your corner and caring for you, it can only be a help to any recovery that you are pursuing. And so we want to focus on really solidifying that partnership to ensure that any patients in our care are definitely and deeply connected with their faith community, and that their faith community feels that they can be deeply connected with their members, and that they can lean on us to share with us how we can best be a support for them while they are in our care. So I'll turn it over to Cathy Palazzolo, our chaplain, as she explains to you some of the ways that you can continue to stay connected with us to support your members.
Thank you, Desiree.
You're welcome.
The reasons, here are some of the reasons. There are many. Spiritual health tends to support healthy behavior and practices. When a patient begins to acknowledge that they have a purpose and there's a greater plan in their life, and they'll want to live a healthier life. Hospitalization, though, can be a very distressing time in their lives. The uncertainty of what is going on with them, being alone, they're out of their regular routine. That can cause a lot of stress. And having a belief system, someone like Desiree said, bigger than themselves, or something that they believe in, their faith that they believe in, can help them to recover faster. And having someone from their faith community come in to visit them also adds that peace and that inner joy. Maintaining a sense of belonging to a faith community that expresses concern, that is physically coming there or reaching out to them while they're in the hospital, and that also will support their healing. And support brings an inner comfort and strength to the patient and the family members. When they come into the hospital, a lot of times things are confusing, or they just have to go through a lot, and it can be one of their darkest moments. And just to have someone from their faith community come in and just stand alongside of them, will bring them, more comfort, and definitely will strengthen not only their faith, but that relationship with their faith community. Some of the benefits of the partnership is that the faith community will be able to extend the spiritual care to the hospitalized member through liaisons that are willing to visit patients in person or virtually. Having someone from your own faith community come in and visit is definitely vital to their healing. Chaplains here I'm the chaplain here, but myself and Father Peter can support the liaison regarding the patient's special needs. We collaborate to maximize the spiritual support. So here the patient is getting spiritual support from here at the hospital, from pastoral care, as well as the faith community. And it'll improve communication and increase the spiritual support that is available to them. And together we can create strategies that can encourage the practice of health promoting behaviors.
Absolutely. And I just wanted to mention and touch on the virtual visits. During the height of COVID, it became a necessity to connect our patients with their family virtually because visitation wasn't permitted. And there are still some limitations on visitation, which we'll go over later. But if the patient is, if you are not able to visit, or the patient cannot be visited for whatever reason, we do have iPads available that we can utilize to connect you with the patient. So if there's any concerns about being in the hospital or exposure, we can certainly continue to make connection available to you virtually.
So the process would be, of course, the member is admitted into the hospital. Clara Maass spiritual care team and the patient's house of worship communicate regarding these members' admission. Here in pastoral care, our chaplain and the liaison will connect to determine the spiritual support plan for a patient. So if a visitor comes in and is visiting with the patient, then we can communicate and like I could follow up, the chaplain could follow up, Father Peter could follow up with what's the visits that's going on, and we keep in communication. So we know that not only is the patient being seen by someone here at the hospital, but they're also being seen by someone in their own faith community. They may not know that person, depending on how large that faith community is, but just knowing that someone is connecting to them from their own faith community, and then having someone from the hospital also come in and work along with the liaison is just more of an overall complete support in their spiritual support that they can receive while they're here.
Right, and so the way that this might happen can vary. So when patients are admitted to our hospital, they are asked the question about their religion. And if they do have a strong connection with a house of worship, they may mention it or they may not. So sometimes it's not revealed until maybe Kathy or Father Peter has visited the patient that they do have a strong connection with the faith community. Or you may understand or learn from a family member of the patient that they've been admitted. So however this connection can be facilitated, the best way, it's ideal if there's a relationship forged, and that whoever the liaison might be for your house of worship has connected with Kathy, so she can have in the back of her mind, oh, this person is part of Pastor Pablo's church. Let me give Pastor Pablo a call and see if he wants to visit, or maybe I can bring my iPad with me when I visit this patient to connect Pastor Pablo with this patient. So the quicker we can get that support to the patient, the better.
And then there's aftercare. A liaison would have the freedom to be able to make home visits, offering comfort and support for the patient and the family after they've left the hospital. A lot of times when they're in the hospital, they get the care, they get people visiting them, they feel better, they're going home, and then sometimes it might feel to some people that it's just dropped off. So the liaison does have the freedom to be able to go and make home visits, offering them support, continued support after they've left the hospital. And also they could bring them or provide community resources that may be available to them that maybe they're not aware of, or when they got home, they just hadn't had the chance yet to look into these things, and the liaison can be a source for them to help them connect to other community resources and resources that the House of Worship has for them as well, to continue the healing process after they've left the hospital. So they still feel that connection and that support continuing on, even though they're no longer at Clara Maass. So you can become a partner with Clara Maass by contacting the Spiritual Care Office. The number is there on your screen, and just indicate that you have a desire to participate in this. The members, the liaisons that will visit your members are chosen by you. They will receive information on training and certain things like that, but they are selected by the leaders of the faith community, not by the hospital. So there's a few things that we'll need to prepare the liaisons for before they visit or they make a visitation. And one is the latest policy and procedures for visiting patients at the hospital. These are, in today's times with everything going on here, these policies and procedures change. Right now, we're still, the volunteers aren't coming in, but visitation is. And another preparation that the liaison should make is that their purpose here is to build a rapport and trust with that patient. and there's different ways that you can do that. We're going to go over that in a little bit. Practicing listening and being present in the conversation. You know, sometimes you'll go into a visit to see someone and it's hard to get them to start talking, but if they do start to talk, it's really important that you give them not only the physical, but the attention that they deserve. And then there's also guidelines for home visits. These are all guidelines and these are all practices that each visitor should be aware of. And it just makes the process of visiting in the hospital and outside the hospital more comfortable for the liaison as well as the chaplain and the patient.
So as Kathy mentioned, the safety protocols for visitors, we just want to make sure everyone is aware so that if you do decide there's someone that you want to visit, you know what to expect. So of course, as I'm sure you would expect, all visitors are required to wear face masks. When anyone enters the hospital, no matter who they are, symptom checks and temperature checks are done. Everyone is screened for recent travel, and ask questions around exposure and requirements to quarantine, and any exposure, any symptomatic visitors or anyone that has been guided to quarantine because of exposure won't be allowed to visit and shouldn't make the attempt to visit. I just also wanted to mention that these visitation policies, as Kathy mentioned, and so did Michael, sometimes these things are moving because of determinations being made for the safety measures that are relevant at the moment. So at one point in time, there were no visitors permitted, as you would expect. Now there's a certain level of visitation that we'll go over in a moment. But before you attempt to visit, I would just visit our website to make sure that you're up to date on all the current visiting practices. Of course, all hand hygiene is expected, and all visitors will be asked to comply with reasonable requirements so that if for some reason there's a large gathering of visitors, only one visitor in most cases will be allowed at a time, and so others would be asked to wait outdoors. So we just want to make sure you have that preparation. So if you do have a large faith community or a large group of supporters or several supporters that do want to visit that patient, they should do so individually and not come together. So just to kind of touch on, every department has specific guidelines for what's permitted. And so I'm not going to go over every single one, but I just want you to be aware that there are the general guidelines, but then there are also unit specific guidelines. Wanda, I know you spoke very specifically about the PES unit. Could you give us a little bit of insight about the guidelines if visitation is permitted in that unit or not?
At this point, it is not. The system has decided in the behavioral health units for a variety of reasons that no visitors will be permitted until further notice. We really don't have large enough room space to have additional individuals on the unit. In PES, it's the same on the voluntary and involuntary units at this point, but certainly we can make the same accommodations to use the iPads to do visits. You know, we are in constant phone contact with family members while patients are on our unit to keep updating them about the process and where we are. But at this time, unfortunately, we cannot have visitors.
Okay. Thank you, Wanda. Thank you. So absolutely. I mean, the virtual visits are an excellent option. So there's no need for us to avoid visitation when these options are made available. Okay. So I'll just turn it over to Kathy. She wants to give you a couple of final pointers that liaisons should be mindful of in visitation.
So one thing that's really important before a liaison would go in to visit someone is to make sure they're calm and they've taken the time for self-care. That's very important that they go into the room confident and calm. And a way to do that is just, you know, simple, quick 2-minute deep breathing exercises, things like that. Self-care is very important. And if the visitor goes in, the liaison goes in to visit the patient and they're relaxed, then of course the patient's going to be more relaxed. One of the procedures is definitely to always knock first and identify yourself. Not every liaison is going to know every single patient that they're going to visit. I mean, they're part of the faith community, but they might not have a specific relationship with them other than attending the same house of worship. So we always want to knock and identify ourselves, and also be prepared to explain who you are and where you're from. Some patients might not recognize you, they might not remember, but it's really important because that sets the tone of the room when you enter the room. And communicating clearly is definitely, well, you know, with masks on, sometimes that's not so easy, but to clearly speak and let them understand. And if they don't understand what you're trying to say, then try to make everything clearer. So, and don't continue on until you understand that they are understanding what you're saying. And of course, always come to the visit and with compassion and understanding. These the patients are in a very vulnerable state at this time. They're not feeling well. Things are going on. There's just a lot going on at this time. So when a visitor comes in and is compassionate and understanding of the situation, then it just makes that visit easier for both parties. Practice of listening and presence. Active listening is it's a lot of things. It's paying attention to what they have to say, and actually showing them that you're listening, providing some feedback, but also deferring judgment. So if they're complaining about something, you don't want to talk about that. We can just go over that. Or if they're saying something about someone, that's not a conversation that you really want to get into, because you've already explained to them that your purpose for visiting them is for them, like they are the focus, and to make them feel a little more comfortable to their environment, or the fact that somebody just came and is reaching out to you, and now let's just see what your needs are. And that's the purpose of going in there. So when we listen to what they have to say and are very tentative, that also creates that bond and that trust. And being present is always maintaining the eye contact when you're talking with someone. Everyone knows that if you're in a conversation with someone and you're looking around and they're talking, that they get that sense that you're really not paying attention. Little simple nods in understanding, or even a smile, can go a long way. And one thing is, if you lean in towards someone when they're talking, that's an unconscious way of them knowing that you're listening to them, that you really are paying attention, and you want to hear every word that they're saying, because those words that they're saying are very important. Building trust. Sometimes you can build trust with a simple smile. You walk in and you just smile at them, and they'll respond. They'll respond even if they're feeling like so sick or just agitated. A simple smile can go a long way. One important thing is to keep the visit short. You don't want to stay there for a long period of time. Offer prayer. We know that all faiths have prayer, and sometimes it's really hard for a patient to be praying, but if someone comes in and just offers a prayer to them, and that can get them started, and sometimes they'll say no, and that's okay. You're there to meet their needs and to visit with them and to make them a little more comfortable. That's being a good confidant and not forcing them into anything that they don't want to do. So the whole point of the visitation is that you're present with them, and you stand alongside of them and travel this journey with them, so they know that they're not alone. And before leaving, we always ask if we can visit them again, and thanking them for letting you share their time with them. That gives them the feeling that you feel that their time, even though they're in a hospital and they're not really going anywhere at that time, their time is still very precious and important to you. So after they leave the hospital, there are some guidelines for a home visit that the one important thing to start with is that you arrange for a visit in advance and check the location, make sure that it's accurate. You don't want to surprise anybody. You don't want to be surprised if you just happen to show up. You don't really know what you're walking into and they're not expecting you. So it's very important to arrange for the visit in advance and double check that location, that the information that you have is accurate. Be clear about the purpose of the visit. The purpose of the visit is to continue to help them, continue to show that even though they've left the hospital, that that the visitor is still, the liaison is still there for them and caring about their needs, even though they're home. Safety is first though, so be sure that someone knows where you are, someone from your faith community leader, someone there that knows where you are and when you're expected to be there. And if you can put a limit, like, 15 minutes or half an hour, a timing, so you know that not only you know how long the time will be, but the person that you're visiting will also expect only a short, quick visit. That also gives them the comfort that, oh yeah, I can handle a 15-minute visit or a 20-minute visit. Yes, please come, and you're getting permission as well. And one thing is to respect your boundaries when you're communicating, like by not trying to tell them what they should do, just offer things to them and respect their boundaries. Because once you've respected their boundaries in their own home, then that trust and that bond just gets stronger and stronger. So I'd like to thank you for this time and this opportunity. Thank you, Desyra, for assisting with this. And I just wish you all have a great day.
Well, I also put my telephone number in the chat. So if, for any reason you're not able to reach someone in the spiritual care department and you need to connect with someone, you can certainly reach out to me as well. Thank you for having us. Thank you for the invitation.
Thank you. Thank you, Desyra and Cathy. I'm looking in the chat and the question and answer and the Q&A. I don't see any questions at this time. There was one before, but you answered it during your presentation. So if anyone else has any questions, please feel free to put that in the Q&A box. Without further ado, I'm going to have Michael present. He's going to talk a little bit about what he does and some of the cases that he sees. And if you have any other questions, we can always answer them after Michael's presentation as well. So thank you. We can't hear you, Michael. You have to unmute yourself. No, you're still muted.
Is that better?
Yes.
Okay. We thank you for this opportunity to present some of the things that Clara Maass can do to help the community and ADAPT itself. You see that we touch on the very nuts and bolts of addictions, mental health, and we also have those who can help you with any spiritual difficulties and help. So we're here. Please call us. Let us know if there's any help that we can give, because we'll certainly be calling on you for any help in this very trying time that we're in. We're living in a society that's increasing in their alcohol and substance abuse. Now, the data is not quite on paper yet. They haven't had time, but as I look through the information, all providers are considering that people are increasing in their alcohol use and consumption. Some making a joke about it. People no longer drink martinis, they drink quarantinis. Bars and taverns weren't able to have people come, so they were having Zoom meetings with their with the people who would come there so that they could drink together on screen. But yet we know that all of this leads to a more devastating aspect of our families, our friends, as the drinking. One of the things I do when I'm counseling or treating somebody who has an alcohol problem, one of the questions I'll use that is very telling is, do you drink alone? Used to be that people who drank alone had a very big problem. Now, due to social distancing and lockdown, everybody's drinking alone. And it becomes increasingly problematic. Now, as I said before, we will have therapeutics, we will eventually have a vaccine, but those won't help those people who have initiated their substance abuse or their drinking, or those who have relapsed due to the fear of loss of job, due to the fear of becoming sick. One of the things ADAPT will be able to help, and those of you who are participants and friends of ADAPT, is the old systems are getting lost. Narcotics Anonymous, Alcoholics Anonymous were based on a socialization and sponsorship theme, where people would gather together, they would tell their stories, they would commiserate, and they would receive help. Well, they're not doing that anymore. They're doing it virtual. Problem with that is the people who have drug and alcohol problems don't have much access to computers and to Zoom meetings, nor do they really have the incentive to go that far. So the treatments that they have, the helps that they have begun to get lost. All that has happened over the past few months have been tailor-made for increase in use and abuse. The fear that has been out there, the social isolation, not being able to depend on friends and family. You couldn't see your therapist. And it has been tailor-made for people going in the wrong direction, which is abusing drugs and alcohol even more. We have the potential for relapse, but we also have people who maybe have been social drinkers who are now drinking a little bit more. People who are utilizing drugs to temper any fears and worries that they have. For the people in the ADAPT community, Clara Maass certainly stands ready to help you with that. You see that we do have people who will go out and will help you. But we're not sure if you need help unless you call us and tell us. So as Desyra has put her number up for the spiritual aspect of the help that Clara Maass has, and Wanda has given you the number for the crisis. Oh, and by the way, with crisis, if you call that number, that doesn't mean that you're going to get committed. We're a helpline. We can help you on the spot with counseling and with therapy and with information, with referral on where you might be able to get help. So don't be afraid to call or give that number out to one of your loved ones. We can help you with that. I want you to consider those of you in the audience who are pastors, who are deacons, those of you who have family members. If you notice that there has been an increase in any substance abuse or any alcohol consumption, I want you to consider that those people put themselves at a greater risk, especially in this time, because drugs and alcohol significantly impair the immune system. Significant problems caused with the immune system. Increase in drug and alcohol lessens inhibitions. So people are putting themselves in places of more risk. Their judgment is impaired. So it is important for those of us online, most of us are professionals in aspects of counseling, therapy, church work, that we are aware that these problems are taking place. It may not just be that somebody's drinking a little bit more, but that as a result of that, they are putting themselves at more risk for the dangers that are prevalent with us. There are financial fears, loss of employment, fears about getting sick, and then there's other complications when at the height of the pandemic at Clara Maass, some of the other aspects of healthcare had to be decreased because of the volume that we were receiving. And then people will maybe medicate themselves other than finding the help that the doctor has. Well, we as professionals, and I know I can speak for Jessica and Julia and Joel and Emlyn, ADAP stands at the ready to help. A call, a note. There are many people involved in ADAP in many and varied capacities that can help, just as Clara Maass, you saw today, has many capacities to help. We stand ready to help. Please, in this time that we're in, it is not a good idea to keep silent. It is a good idea to reach out, to make the call, even if it may not be wanted by a loved one or a friend. Maybe they need that. So we are standing ready. Just a couple of things, just to be aware of the dangers. Online sales of alcohol have risen 500% since March. 500%. And the rate of increase through, you used to not be able to go to a bar and get like deliveries, but now you can. It's increased 55%. And on that end, we can see it. On the other end, with the substance abuse, you can't even tell the gravity of increase that has been there. So I would encourage each and every one, those are members with ADAP, those of you who are listening, join with ADAP, utilize ADAP, Clara Maass, to assist you with any difficulties that you encounter, whether it be for yourself, your family, your friends, your parishioners. Nobody's immune to the virus, and nobody is immune to the effects that the virus may have in many and varied respects. So we stand ready to help, both at ADAP and Clara Maass. Reach out, let us know what we can do, okay? Thank you very much for being with us today. We're happy to come to you to offer the help that we have, and we will continue to. Thank you again. Jessica?
Thank you so much, Michael. Thank you so much to everyone, the whole team at Clara Maass Medical Center for presenting today and providing us information on various aspects of the PES unit and also services for faith-based and some, of course, safety protocols as well. I just wanted to mention in the chat box is the PES 24-hour hotline number for Clara Maass, as well as Cathy's and Desiree's number if you want to get in touch with them to connect with the hospital. Deacon Ingalls also mentioned that there are some NA meetings meeting in person, Narcotics Anonymous, as well as, I'm trying to see, that right now they're meeting in Berrien County, and he's going to find out about some opening up in Essex County. So things are opening up. As always, please be safe when going out. The pandemic is still present, and we want everyone to be safe and healthy. At this time, I'm going to turn it over to Gwenera to give us some information about the next portion of our session.
Good morning again, everyone. Thank you for joining us. And I do want to say and acknowledge again, thank you to the Clara Maass team, Michael, Desiree, Wanda, and Kathy. That was very informative. And thank you for the open invitation, even not for just now, but futuristically, the needs that may arise and presenting us with contact information. So thank you for that. So before we move to the next segment, I just thought it would be good for those of you that know chair yoga or anything else. We've been a little sedentary for about 45 minutes to an hour. Take a moment, just stretch, just find something to do to just get that blood circulating again, and just to refresh your mind as we move into the think tank component, Q&A, and through the chat box. So let's open it up first with the individual component. If all the participants can utilize the chat box for responses to how, based upon the presentation, based upon the information that was shared, how would you set a goal, or how has this information influenced you personally? And personally can be in your family, could be in your own person, but we want to kind of understand, based upon all that was presented, the wealth of information that Clara Maass team presented, how this resonates with you, and what goals can you set in regards to the information you received. And as they arise, I will attempt to create dialogue around it to engage other participants. Was the information that good that no one thus far has indicated implementation or practical ways to utilize the information that was presented by Clara Maass? Is there any professional goals or aspects that you gained as a part of the information that was presented, or ways that you can influence, serve, meet the needs of those that are a part of your world professionally, through your faith-based house, or even in your community? Okay, we have a few comments. So for individuals in my network experiencing mental, emotional issues, I can refer them to the crisis helpline. Agreed. Was not as aware of all of the touch points, if you will, of Clara Maass, and so that was informative. I think it has motivated me to perhaps start a group within my church dedicated to serving the community as visitors to those in need of support. I love that suggestion. I love that goal. As I believe, and I may get the names mixed up, I'm not sure if it was Wanda or Kathy talked about visitation and the significance of that. And so considering starting a group within your church dedicated to that would be awesome, would be, I believe, well received and well supported. Through the Q&A, be more aware of the Zoom drinking hours that are fun, but others may overdo it. Okay, certainly, Michael highlighted that, how that has become almost a new norm, if you will. I've seen it myself highlighted and invited to different types of drinking Zoom gatherings. How can you start a discussion with friends about not engaging? Oh, I've led to this one. In Zoom meeting happy hour to have fun and cope with COVID-19. It's So that's a question. If the panelists are still present and would like to address that, we'll allow you to do that. I'll repeat the question again. How can you start discussions with friends about not engaging in Zoom meeting happy hour to have fun and cope with COVID-19? Are the panelists still here? I know I see maybe some screens are grayed out, or perhaps they're not here. Okay, so we have a comment from one of our members. Oh, that was something she gains to be more self-aware of changes in behaviors and attitudes towards virtual social activities. And, you know, one of the things I'll add, this may not directly address, is that there's always has to be a consciousness of those that are witnessing the behavior. Many times I've seen these Zoom gatherings that are, you know, celebratory or engaging in happy hours, but children are onlooking and is presenting to them ways of coping, ways of responding to the stressors and challenges of COVID-19. And so I think just being practical, bring your knowledge, bring your experience, what you know about the influence of alcoholism, and presenting it as a outlet or a coping mechanism, and the unhealthy statistics associated with that would be my suggestion as to how to start a conversation. As casual and as informative as possible will be my suggestion. But I do want to give other panelists as well as ADAPT members opportunity to address that question as well.
So I just want to piggyback off what you were saying, Gwenera. I agree that with everybody having to stay at home more, we are seeing, you know, more parents, you know, maybe drinking at home, not necessarily, they may not have an issue with it, but the children are seeing their parents drinking more, and it is bringing questions, or they're noticing these things. So it is, I think it's very important, even if they don't bring it up to you, I think it is important to have that conversation with them, explaining, you know, what does socially responsible drinking look like, and where it might be crossing the threshold, you know, into binge drinking and things like that. So being aware of the differences and understanding that children do model after adults, and to be able to recognize that and have those conversations with children. Of course, different ages require different levels of in-depth conversations, but to remember to bring that up as a family unit, discussing that, and that could hopefully that in the future, if children are having any issues with it, they can come to the parents, because they have had these discussions before it's become to a point of addiction, or, you know, of some issue with associated, some consequence associated with it. So just always being aware and present, and acknowledging what is happening in your home as well, especially during these times.
And then as Jessica was speaking, I thought of too, perhaps addressing it from choosing a different coping mechanism. Can we, you know, virtually jog? Can we virtually walk? Can we, you know, find some alternative to what is being presented as the happy hour, or other ways to have an enjoyment hour, or, you know, change the perspective or belief of what happy hour entails, so that there's alternative outlets and ways of coping, as opposed to resorting to drinking that can potentially lead to binge drinking. We do have a question here. How about coffee hour? I'm not sure how to interpret that question. I'm not sure if you're suggesting that coffee hour replaces the happy hour, or if there's some other language that I'm not aware of when it refers to coffee hour. So forgive me for not understanding that question in its totality. But if someone else feels as though they're more versed in understanding that question, please jump in and respond. Okay, based upon the chat and, oh yes, okay. That's how I thought it could be interpreted. So thank you. I didn't want to make an assumption. I know sometimes the lingo changes without me being aware, so I didn't know if coffee hour was a mask for something else. But yes, definitely as an alternative, ways for inappropriate drinking would be to choose a coffee hour, tea chat, book club, etc. Or, because we've been sedentary and most of our hours are spent in front of devices, I like to encourage some movement. I like to encourage that, let's do something together that requires. So our endorphins, those are the things that drive us and fuel us, that kind of get us active in that regard. So thank you, Elise, for that question, and Demetricia for coming in and helping define a response for that as well. So if there aren't any more questions or any more to chat about, we want to thank you for being here today. Thank you for participating. I'm going to turn it back over to Jessica as we conclude with some final notes. Enjoy your day, everyone.
Thank you, Gwenera. And I'm so sorry we weren't able to break up everybody into small breakout rooms. We're going to try to troubleshoot that after this session to see if we can do that for the following sessions, because we do like to give you opportunity to interact with each other on a smaller level. And so we will be working on that. Okay. All right, so just some announcements regarding ADAPT events. So all of our events could be accessed at the link in there, and I'm going to put it in the chat box as well as on our Facebook page. We have all our events at Essex Adapt as well in there. So this afternoon at 2 o'clock, we're going to be hearing from Phil McCabe talk about our new normal, the importance of rituals in our daily lives. So please sign in for that later on this afternoon. And then don't forget the rest of our symposium days are next on Thursdays, October 15th, 22nd, and 29th, sessions at 10 a.m. and at 2 p.m. on all those days. Everyone should have seen the program. It was sent to everyone's email. It's in our Eventbrite online page. I put it in the chat box. Reach out to me if you still didn't get it. I can send it out as a PDF to your personal email, but it is available in different locations. It just lists all of our webinars and our speakers, our biographies of our speakers, and some contact information as well. October 13th, we have our LGBTQ plus committee meeting. We welcome you to join us for that. And October 20th at 10 a.m. is our prescription drugs committee meeting. October 23rd, we're having a kickoff event for our youth coalition program called Incorruptible Essex. And we are inviting youth ages 13 to 18 from Essex County to come and join us for an hour. It's going to be activities, games. We're getting to know each other, opportunity to show you what we are doing with the Incorruptible Essex Youth Coalition. And they'll also be giving away gift cards and some prizes. So please, we'll be sending that information out shortly this week, but I just wanted to give you a heads up about it today. All right, last but not least, we'd like to know how we did. If you can complete a brief evaluation about this session. For those of you that like to click and scan things on your phone, you could do that here. Just scan the screen that you have in front of you, and then a link will pop up. You can just click on that, and our survey will pop up. Or when the webinar ends, a survey will pop up as well on your screen. If you can just take a few minutes and just complete that to let us know what we can do better for next time. And then we will see you all at the next session. The next session is this afternoon at 2 p.m. Okay, so thank you all for coming and joining us. And we're leaving you out early, so that's always a good thing. Have a wonderful day, everyone.
Thank you, Jen.